Before we begin the next step, a few announcements about conference resource materials. The conference proceedings book and the abstract book are now accessible and available for download via the SLCIM mobile app. The conference lecture presentations will also be made available on the app, and access code will be emailed to all registrants within the next week. We wish to draw your attention to another announcement. A mobile phone of a delegate has been misplaced. If found, kindly hand it over to the SIMCON registration desk. Thank you for your cooperation. With that, we'll move on to the next stage. We now move on to one of the most anticipated moments of the conference, the SIMCON Quiz. To conduct the SIMCON Quiz, may I invite Dr. Ushani Varya Peruma and Dr. Dilshan Pereira to the stage.
Good evening, ladies and gentlemen. We have come to a very exciting segment of SIMCON 2025, which is the SIMCON 2025 quiz. So I am Dilshan.
I'm Ushani.
So before starting the quiz, I have to make some announcement. So the organizing committee has, prepared 3 exciting gifts for the 3 winners. First place, second place, and third place of this quiz. Therefore, I recommend all of you to join the quiz. So before starting the quiz, I will talk about the ground rules. So we have 15 questions in today's quiz, plus a test question. Obviously, we won't be awarding any marks for the test question. So this quiz will be held online on AHA Slides platform. So you need a mobile phone or a device with internet connection. Please make sure that your data is on. So actually you can scan this QR code and join AHA Slides. Make sure that you enter your name properly. It will be better if you can enter your name and surname. Otherwise, there can be some discrepancies whether we won't be able to find the winner if you just add some initials. So please make sure that you enter your name in such a way that you can be identified. So we'll allow you to join using the QR code. And then regarding the 15 questions, so alternately we will be reading out the questions. So you will be given ample time to look at the question. Then in the next slide, you will be given 4 answers. So it will be best of 4. You will be given only 10 seconds to answer the question. So if you don't answer or if you answer incorrectly, you won't be awarded any marks. There won't be any negative marks. So please feel free to answer. And then if you answer correctly, you will be awarded marks according to how quickly you responded. So there are 10 seconds. So suppose that you answered within 9 seconds, you will be awarded 90 marks, so on and so forth. Okay. So at the end of the day, what matters is the number of correct answers as well as how fast you are. Okay. So
let's start.
First, let's start with our test question. Do we know whether the contestants have joined? Okay, so this is the question. Where is this famous monument located? And the answers are So they are still joining. We encourage everyone to join. Whether you are a PG trainee or even a consultant, that doesn't matter. Before that, I would like to make another announcement. So at the end of each four questions, we will be showing you the leaderboard. So at the end of 4, 8, and 12 questions, you know where you stand, and then at the end. So these are the 4 answers. You can answer now. Okay, so we have 38 correct answers. We know Stonehenge is located in England. Okay. Right, I think now you have got the hang of it. If everyone is ready, let's move on with the quiz proper. Shall we start the quiz? Okay, we'll start the first question. So we will move on with the Sri Lankan history. So the following image is from a famous movie based on an incident that occurred at National Hospital, Colombo, some time ago. My question is, what is the name of the movie? Let's see the answers. Okay, good. 66 people have answered correctly. Okay, so the movie was named as according to Matthew. So this incident is a true incident that occurred in National Hospital. You would have seen this church along the Kingsey Road, which is now next to cardiology unit. It is an Anglican church. A famous priest named Father Matthew Peris was incriminated for double murder. So I think it was in early 1970s. So 2 patients admitted with very mysterious hypoglycemia, one being his wife and then another gentleman. Both were found to have been poisoned slowly with those days glibenclamide. So he was incriminated for convicting double murder. Right. So shall we move on with the second question? Identify this medically important snake. Shall we see the answers? You have 10 seconds to answer. Okay. Responses are not that great. So 29 people have answers correctly. So this is Sri Lanka keelback, also known as Mal Karavala in Sinhala, also known as blossom crate. Even though we name it as a crate, it is not a true crate. It is a colubrid. Generally, colubrids are not poisonous, but in 2015, in Sri Lanka, they have reported the first case of serious systemic envenomation due to this snake. So actually, the culprit or the person who got the victim was a 33-year-old biologist who was playing with these snakes. Obviously, he was bitten and he developed severe neurological toxicity as well as coagulopathy, and he was successfully treated with FFP. So this is a moderately venomous snake. that is medically important, even though rarely we come across. Okay, let's move on with the next question. Question number 3 is a patient story. I'll read the story. A 75-year-old female with hypertension treated with amlodipine and hydrochlorothiazide presented with confusion for 2 days. On admission, the GCS was 14. Her serum sodium level was 110 millimoles per liter. After the initial management, her GCS dropped to 9. The T2 weighted MRI brain is shown. What is the radiological sign seen? Shall we see the answers? Not bad, not great. Okay. So 52 have answered correctly. So this is a very straightforward case of osmotic demyelination. You don't need imaging to diagnose this case, right? But this is the imaging finding, right? So this is called the trident sign. I'm sure that you have watched Aquaman. The Aquaman carries the trident. In Sinhalese, in Tamil culture, we know Trishulaya, okay? So that is the image of this. So osmotic demyelination due to inappropriate or rapid correction of sodium. So that is the correct answer. Shall we move on with the 4th question? Okay, another blast from the past. So these 2 famous scientists suffered from the same illness. To make it easy, I'll tell you the scientists, Benjamin Franklin and Isaac Newton. The question is, what is the illness they suffer from? Shall we move on with the answer? Okay. So 28 people have guessed it's gout. Gout is the answer. So now we have completed 4 questions. Shall we look at the leaderboard now? Okay. So Deepta is leading, followed by SC Manchanayaka, so on and so forth. So these 4 are the top 4 players. Don't worry, you can come to the top, the others can come to the top. So only the top floor are displayed here. Okay, now shall we move on with the next question? Question number 5. Okay, another patient story. A 45-year-old previously healthy female presented with painless swelling of her hand with several nodules for 1 week duration. She's an avid gardener. To be precise, she's a rose gardener. And then there are no systemic symptoms. This is her hand. Shall we move on with the question? Okay, the question is, what is the treatment? Okay, 15 people have given the correct answer. I know it's a bummer, okay. So actually this is called rose gardener's disease. The clue is she's a gardener, and I mentioned roses as well at the end. So this is an unusual infection, right? It is caused by a fungus, right? Okay, it is called sporotrichosis or Sporotrix schenki is the name of the fungus. So what happens is, in an immunocompetent patient, when you get a prick due to rose thorn, especially when you are meddling with the soil as well, this fungus will get inoculated, and then initially there will be a papule, which will turn up to become a painless nodule, and which might ulcerate, and then it slowly spreads along the lymphatics. That is why along the lymphatics you get these painless nodules. In immunocompetent patients, you don't have to worry. You have to eradicate the fungus with the oral itraconazole. But if the patient is immunocompromised, then that's going to be a problem. The patient will need systemic antifungals. Okay, now we have completed 5 questions. I will hand over to Dr. Ushani to continue with the next 5 questions.
We again start off with a case history. A 29-year-old woman presenting with severe colicky abdominal pain and vomiting. She has had similar episodes in the past. On the 3rd day of the illness, she developed progressive weakness of both lower limbs and later followed by generalized tonic-clonic seizures. Examination of the lower limb, flaccid, symmetrical, proximal lower limb weakness with depressed reflexes and normal sensation. Serum sodium is low, potassium is normal. Rest of the basic blood investigations and NCCT brain is normal, and she undergoes a lumbar puncture for further evaluation. So our question is, let's move to the question. Okay, only 14 got the answer. So the case, when you think of the whole case scenario, what's the diagnosis? It's a porphyria, acute intermittent porphyria. So the closest, but when you put all of them together, there's no other, it's the diagnosis. But you can think of things like recurrent history, hypokalemic periodic paralysis, but the potassium, we have given it as normal. Then things like Guillain-Barré would not typically give a picture of recurrent paralysis. And we are not asking the diagnosis, but we rather asking for the CSF finding, which is normal in acute intermittent porphyria. Okay, then let's move with the next question. Then again, we have another case history. These are real patients, like a 50-year-old man with poorly controlled diabetes, 1 week history of left-sided facial pain, periorbital swelling, and nasal blockage. Examination reveals a partial ophthalmoplegia, proptosis, and a black necrotic patch on the left middle turbinate. CT scan is shown here. You can see the circled area where there is bone erosion, and the biopsy of the necrosed region showed infiltrate of inflammatory cells with vascular invasion. So what we are asking for is, let's move to the answers. What is the most appropriate initial treatment? Okay, that's good. A lot of people have got the answer correct. So it's mucormycosis, and the other differentials would be, if we leave aside the treatment being given, you can think of things like vaginous. And in the context of immunosuppression, the closest next DD would be whether something like invasive aspergillosis. So, but the answer, what is the key factor which gives away the diagnosis? Which points in the slide, if you remember, it's the vascular invasion. So the mucormycosis is characterized by vascular invasion. So that is the kind of the hard clue which gives away the diagnosis. And we are asking for the treatment, which is IV intravenous liposomal amphotericin B. So voriconazole is for invasive aspergillosis. Caspofungin and fluconazole or voriconazole will not be responding to the invasive mucormycosis, and caspofungin and fluconazole are mainly for candida infections. Yeah, let's move with the next question. Okay, we have another case history. A 52-year-old woman with major depressive disorder presents to the ETU with fever, agitation, and tremulousness that developed over past 6 hours. She has been on sertraline and tramadol and chlorpheniramine and metoclopramide prescribed for various things with the background of being on sertraline for several months. Examination, temperature is elevated with tachycardia and elevated blood pressure. She is agitated, diabetic, pupils are reactive. On examination, in her limbs, the tone is increased with hyperreflexia and inducible clonus, no neck stiffness or other focal neurological deficit. So here it's straightforward. We are asking for the diagnosis. Let's move to the Okay, again, that's good. It's straightforward, serotonin syndrome. So in the history, she has all the features of being on either serotonergic or serotonin-enhancing drugs. And in the examination, the hallmark, the differentiation feature is the CNS excitability with hyperreflexia and having inducible clonus. So when you put all these things together, it's serotonin syndrome. So neuroleptic malignant, usually you get reflexes are not exaggerated, and in anticholinergic toxicity you would expect pupil dilated pupils and all. So it's the classic fit for the case is the serotonin syndrome. Okay, let's move it. Let's have a look at the leaderboard. That's good. Deepta is still scoring, and the second place is taken over by Ishanya. Okay, let's move with the let's move with the next question. Okay. It's a 25-year-old female with palpitations. We are asking for the ECG diagnosis. I think we have the ECG on the next slide as well. So let's move to the answers. Okay, so I thought the closest one scored would be ventricular tachycardia, but very few people have selected it. So it's usually, the depth would be between whether it's SVT with aberrant conduction or VT. So here, what is, and like orthodromic AV re-entry tachycardia, AVNRT with pre-excitation, the classic delta waves are not seen here. So that makes it out. And atrial fibrillation with bundle branch block, of course, we would expect a kind of a irregular rhythm. So this is fairly regular. So actually the debate would be whether it's VT or SVT with aberrant contraction. So what favors SVT here is with VT, you would expect extreme axis, which is not present here, and the concordance is not there, and you would classically see capture beats and fusion beats in VT. So those things would differentiate a VT from, along with few other criteria, would differentiate VT from SVT with aberrant contraction. Okay, so let's move with the next question. So the next question is a tribute to the college because we have taken a lot of efforts on POCUS. So this is a POCUS image of a patient presenting to the ETU with acute shortness of breath. So we are asking for the diagnosis. Let's move with the diagnosis. That's good. So it's because it shows the classic B lines, which is seen in pulmonary edema. Okay, I think I'll hand over to my colleague, Dr. Dilshan, to move forward with the rest of the quiz question.
Now, ladies and gentlemen, now we are moving with the home stretch, the last 5 questions. So question number 11, another patient story. A 35-year-old previously normotensive male developed generalized rash 3 minutes after ingesting peanuts. His vital parameters, pulse is tachycardic, 150 beats per minute, which is sinus tachycardia. His blood pressure is high, 180 by 90. Remember, he was previously normotensive. Saturation is 92%. And this is his hand. And the question is, what is the immediate management? I'm quite happy with the answers. 53% want to give adrenaline. So why do you think this is anaphylaxis? The blood pressure is high. He was normotensive, but the blood pressure is high. Would you still think this is anaphylaxis? Yes, this is a very rare case of anaphylaxis with hypertension. Only a handful of case reports have been reported. I happen to manage 2 patients during the last 2.5 years. The first patient being a patient who got AstraZeneca's second vaccine, who developed tachycardia, dizziness, and hypertension, unexplained hypertension. He was a normotensive patient. So after giving adrenaline, both tachycardia and hypertension resolved remarkably. The second patient, diagnosed patient with leptospirosis with no previous allergies, developed urticaria and then stridor soon after giving ceftriaxone. He had a blood pressure of, before giving ceftriaxone, his blood pressure was normal. He was agitated. The blood pressure was 200/100 and he had tachycardia. So soon after giving adrenaline, the patient recovered miraculously and started eating also. So that was a remarkable thing. So remember, physicians and anesthetists will hesitate to give adrenaline when the blood pressure is high. But the take-home message is, in anaphylaxis, regardless of the blood pressure, the first line medication is IM adrenaline. It is not hydrocortisone. Okay. Shall we move on with the next question? Okay. Another patient story. A 26-year-old pregnant lady with a POA of 34 weeks was admitted with headache, neck stiffness, and fever for 3 days. She was commenced on IV ceftriaxone 2 gram BD for meningitis. The CSF was suggestive of bacterial meningitis. The sugars were low, proteins were high, polymorphs 20 with 0 lymphocytes. So despite aggressive treatment, she deteriorated over the next 3 days. But the brain imaging that was at the onset as well as after deterioration was normal. There was no obstructive hydrocephalus, nothing to suggest anything sinister going on. The question is, what is the next step of management? Okay, 38 have answered correctly. So what do you think the diagnosis is? So remember, extremes of age, immunocompromised patients, and pregnancy, and not responding to ceftriaxone, think about listeriosis. Listeria monocytogenes, the first line antibiotic is ampicillin. It does not respond to conventional cephalosporins. Okay, so Listeria monocytogenes causing meningitis. Okay. Right. Shall we move on with the next question? I forgot to show the leaderboard. Yeah, that's fine. Okay. So the last 3 questions, isn't it? Okay. Right. So the following book is about the horrors of human experiments that was conducted during the Nazi rule. So this book is titled as Doctors from Hell: The Horrific Accounts of Nazi Experiments on Humans. So after the end of the World War II, because of this extreme cruelty, people got together and decided that this should never happen again. So humans are not lab rats. We should practice ethical principles as far as human experiments are concerned. Now, the question is, okay, shall we move on with the question?
We'll see the leaderboard next.
So this led to a declaration. What is that called? I know it's a bummer again, right? So most of you thought it's Nuremberg. Actually, it was the Nuremberg trial that was done in 1947 that convicted most of the Nazi rulers and then some doctors as well. So after this trial, anyway, in early 1960s, we developed the Declaration of Helsinki, which governs the clinical governance in terms of ethical practices related to clinical trials where human beings are involved. So the answer is Declaration of Helsinki, not Nuremberg. Nuremberg is a trial. Okay.
So let's look at the leaderboard
Yes,
to give
let's
them
look at
some
the leaderboard
motivation.
now. Okay, now the leaders have changed. So Ishanya is topping the leaderboard, followed by Chatu Munagama. And then someone named MMFS, is that? And then Deepta. Okay, right. So last two questions. So it can make a difference. Okay. Shall we move on with the 14th question? Easy one. 65-year-old patient with type 2 diabetes was recently added a drug to optimize his sugar control. 1 month later, he admitted with the following condition. Question is, what is the drug? Yes, most of you got it right. So this is SGLT2 inhibitor induced Fournier's gangrene. It is an uncommon but a dreaded complication. So dapagliflozin is the answer. The others do not cause this. Okay, shall we move on with the last question? Question number 15. Right. A 25-year-old male with epilepsy treated with sodium valproate. So far, the epilepsy is well controlled. Was being treated in the ICU for an infectious disease. He developed intractable seizures 2 days after commencing a new medication. His sodium valproate level was markedly reduced. What is the likely drug? Can we see the answers? Okay, I think as physicians, we have to know this, right? So most of you thought rifampicin. Can we move on with the next slide with the explanation? Okay, so we need to know this drug interaction very well because I know meropenem, unlike, I think Professor Kolit Sellehever told during his time, I don't think even we have heard about meropenem. Now it is very commonly used. So remember this drug interaction. Meropenem can cause significant and severe reduction in the sodium valproate level, which occurs very rapidly within the first 24 to 48 hours, right? So sometimes we overlook it, right? So these patients can end up having status epilepticus. All of you thought it's rifampicin. Rifampicin is an enzyme inducer, that is correct. It reduces the sodium valproate level, but not as rapidly as what meropenem does. It takes maybe a few days, more than 5 to 6 days, maybe even weeks to cause a significant reduction in the level of sodium valproate. So the postulated mechanisms are, so meropenem increases the clearance and decreases the enterohepatic circulation of valproate. In addition to that, it inhibits the acyl peptide hydrolase, which converts valproate glucuronide back to its active form. Therefore, in two ways, it reduces the sodium valproate levels significantly and exponentially. So you might think, okay, then before starting meropenem, should we increase the valproate dose? No, that doesn't going to help. So what you have to do is, anticipating this, you might have to add another anti-epileptic that won't have these interactions, such as levetiracetam, and then pray that the patient does not develop status epilepticus, and watch out and anticipate that the patient will develop this complication. Okay, I think now we have concluded the 15 questions. Shall we see the winners? Okay. So first place won by Deepta,
It has
second
jumped
place
and
Shania,
reclaimed.
and MMF. So congratulations, everyone. So we don't know who MMFZ is. So the three winners will be awarded their awards at the end of this session during the award ceremony. Thank you very much.
Thank you.
Thank you, dear Madam and Sir. I call upon Dr. Krishanta Jayasekara, the President SLCIM, on stage to present the certificates of appreciation to our vibrant quizmasters, Dr. Ushani Varia Peruma and Dr. Dilshan